And that's why you're a power mum. Welcome to the Pwrmums podcast. Hi, welcome to Pwrmums podcast. Today we are joined by Tamara and Monica from Physio Down Under. Welcome, ladies.
Thanks for having us.
Thank you. It's lovely to be here.
And Physio Down Under is a specialist women's health clinic for physiotherapy. So we're going to be talking about all things down under today. How many times have you heard that joke?
Yeah.
That was a laugh.
It's actually great when people finally get it. Like they go, "Oh, you're not from Australia." Ah, got it. Yeah.
Oh, it's down there. And when they look at the Y, and the Y is like, oh, the Y is down there as well.
Yeah.
You look at
That's clever. So you put some thought into it.
Yes, many times when we've been to meet doctors, and they always sit there. So which one of you is from Australia? And go, neither. I'm from Brazil. She's from South Africa. But well, yeah. So oh, and then the penny drops. They go, oh, I see. That's such a clever name. Yeah,
that's great. So speaking of down under, we're going to talk about the fact that a lot of women know that at 6 weeks after having a baby, they should see someone like yourselves, a women's health specialist physio, but they don't always know why. So would you guys mind guiding us through the 6-week postpartum checkup of what's normal, what's not normal, what might need referring on? We could be here all day.
Yes.
10 minutes or less.
Yes.
Do you want to start?
Right. So we normally get referrals from a whole range of different people. So you might go to see your obstetrician after you've had your baby, of course, and they might send you to see a physio, or your doula might refer, or your personal trainer who you've seen during pregnancy. So we get referrals from all sources, and women, when they come, we'd like to see them anytime between 6 weeks to even 8 weeks, depending on how they're doing and what they want to be able to do. So if somebody is really keen to go back to exercise, that's when, whenever they are ready, they can come. But we do advise women to come at least up until 12 weeks postnatal is a good time to be thinking about coming to have your physio check.
Look, we can see women at any time, right? So it doesn't really matter. We can see you even, 20 years postnatal, or even if you've never been pregnant, we can see you. But that 6 to 8 week mark is quite optimum, because a lot of that initial healing has occurred. And it's at that point that we can get quite a good idea of what's happening with abdominal muscles, what's happening with pelvic floor, what's happening with posture, and as Monica said, then advise women appropriately as to what would be the best exercise, and if they need a bit more extra help with certain aspects, we can advise it then. So in terms of the actual 6-week check, what happens is a woman would come in and we do a very thorough subjective assessment, which means we sit down with them and we find out what's concerning them. So it could be nothing, I'm just here to make sure everything's okay, or every time I sneeze or cough, I leak urine and it's really, really concerning me, or I've got terrible back pain, or I still look 7 months pregnant, whatever it is. So we work with, okay, that's what's concerning you. And then we ask lots of detailed questions about their birth, what happened. We talk about their bladder function, bowel function. Have they gone back to sexual intercourse? Is that painful? Is that a problem? And then we work out goals based on what they would like to achieve. And then we go ahead and do what we call an objective assessment. Do you want to talk a bit about that?
So yes, so
we're going to do a live demo, actually.
Yes.
Pat's volunteering herself.
Yes, exactly. Yeah, wonderful.
It won't be PG anymore.
So it's really nice to have the opportunity to do this here, actually, because a lot of women don't know really what happens, and when they come for a women's health physio assessment. And so normally we will have a look at the person in standing first, and have a look at their posture, how their abdominal wall is looking. We might get them to do simple things like do a cough or do an effort, or contract their abdominal muscles to see what's happening there. We will look at their back movements if that's an issue. We then generally get them to hop onto the bed, and we may do an assessment of their abdominal muscles lying down on their back. Sometimes we look at them in sitting, inside lying, so different positions to see how those muscles are working. And then but before we actually get to that, we definitely make sure that they feel okay to have a full assessment, and that may include the internal. So if they are happy to have an internal assessment in the first session, then we will be getting their consent and explaining really well what that entails. And so and when we talk about an internal assessment, we're talking about a vaginal assessment. So it may involve using 1 or 2 fingers to assess the pelvic floor muscles, to look at how the perineum is behaving, if that's the right word to use. And we get them to be on their back, covered with a towel. We don't use any instruments, so it's different from doctors in the sense that you will use a speculum to do a pap smear. It's a lot less uncomfortable. It's a lot less invasive, and it tends to be less daunting. And I don't think we've ever had any patients who have felt really uncomfortable from having a vaginal exam with us. So we are assessing their basically the performance of your muscles. So we're looking at how well those muscles can hold a contraction, how coordinated they are. So we are looking at whether you're able to hold a muscle contraction in your pelvic floor and count or speak to us whilst we're doing that.
Oh, so it's not all about, yes, I'm doing it.
Yeah, so that's often what we find a lot is people, it's when we uncover the fact that when we ask people, have you done your pelvic floor muscle exercises? And they go, yes, I've done them throughout pregnancy, I've done them postnatally. And then that's when we're able to check the technique. Not always, sometimes they're perfect on spot, what we want them to do. But many times there is a sense that you're doing more than you need to do. So that's when we are looking, so when we're assessing the pelvic floor control, we're looking as to whether a woman is holding breath, lifting rib cage, tightening up the face, and all those signs that or doing more than you need to be doing. Exactly, compensating. So
but just talking about that, what we know from studies that at least 40% of women will actually do pelvic floor muscles exercises or activation incorrectly. So a lot of them are actually bearing down, so pushing out, as opposed to lifting everything up. And if you can imagine, the whole point of doing pelvic floor muscle a contraction is actually to relieve pressure and lift everything up. If you then pushing everything out, potentially you could do more harm than good. So that's one of the very, very first things we are looking at. And if those women that's one of the first things we try to change. And if they can't change it immediately in that first session, they're not doing pelvic floor muscle exercises as homework, right? Until they can get it correct.
So and I think that's a really crucial thing as well when women are thinking about abdominal recovery postnatally, because many people, I think, come with a sense that they want to fix their belly and their abdominal muscles, but actually we explain to them that understanding how their pelvic floor is working in conjunction with their abdominal area can make a massive difference to how they go on to do their Pilates or their training back in the gym. Because we know that the pelvic floor muscle as a group works really deeply connected to your deep abdominal muscles. A lot of deep words in there. But when you have a good pelvic floor contraction and good endurance, good effort, good technique, you're actually going to get a lot more out of your abdominal rehabilitation. So if you're trying to heal a diastasis, that is an essential step as well to take. And that goes for especially those women who have had C-sections, who kind of go, oh, I don't think I need to check my pelvic floor. And actually many times that's an important step as well to do. So so we're looking at that, and then we're looking at whether the reflexes that happen in the pelvic floor are coming back. So those are the things that when we cough or we laugh or we do a sudden movement, your pelvic floor should reflexively contract up and in a little bit. And that should happen also in the abdominal muscles. But of course, postnatally, those reflexes are often very sluggish, and we need to help them kick back in. And so we check, and if they are very sluggish and not there, we teach women how to regain that. So we are going through a squeeze of the pelvic floor, squeeze, lift, do a little effort like clear your throat or cough and see if you can maintain that, and then relax at the end. So those are some of the things that we're checking when we're looking at pelvic floor. But we're very importantly also looking at the whole support system of the pelvic floor. So that's where we're looking at whether the support of the vaginal walls are optimal. It is normal to have movement and laxity in those walls, and so especially after having a vaginal delivery. So we're looking to what extent that support is there in terms of specifically advising what kind of exercises are safe to do and to go back to. So when women ask us, can I go back to running, and they're 6 or 8 weeks postnatal, we can't tell unless we've checked. So we can't give that individualized advice, and so we talk to them about the time scales, where they are at in terms of their muscle strength, and there are certain criteria that we want to tick off before we give the go ahead. Okay, now you can start doing some high impact and running and jumping and skipping and all those things. Yeah.